prostate cancer is the most common cancer among men. According to the American Cancer Society, about 30,000 men every single year will die from the disease, and black men are twice as likely to get and die from that disease. That's why doctors are saying early screening helps decrease your risk. WFMY News 2's Sydney Moore spoke to one man who is spreading that very same message.
68-year-old Charles Henry has a passion for making people look and feel their best.
Well, I would get up in the morning, get my sisters ready, and I couldn't braid, but I could, connect a plait, like one plait connected to the other, and I just got good with it.
He's a cosmetologist and educator in Greensboro,
It's like you're our family.
the city he's known his entire life.
I was in school, I went to a job fair, and I was intrigued by the school that was there. And I asked a lot of questions, and she said, "You sound like you're very interested in doing this."
He and his students not only talk about skin and hair, but also about staying healthy.
We educate our clients about hair, heart. It's our hair, heart health. We have discussions about health things.
Health is a topic that sits close to his heart after he was diagnosed with prostate cancer in 2022.
I had to navigate my way through that.
He says he wouldn't have known he had the disease if it wasn't for him experiencing a stroke that led him to the hospital. Doctors noticed his lab work results were off track and spotted the cancer through a prostate-specific antigen or PSA test.
I had the biopsy, came back positive, that I did have the cancer. Then I went through a process of trying to decide. I was given some options.
Prostate cancer is a disease of the prostate that impacts older men. Dr. Ted Manny, a urologist with Cone Health, says it is more common and more deadly in black men.
We don't exactly understand why that is. There's several factors that clearly play into it. One, unfortunately, are some racial disparities in access to health care and treatment. The other is just there are genetic differences in black men that make them more prone to the disease.
He says symptoms include blood in the urine, difficulty with urination, or sometimes unexplained weight loss.
Unfortunately, when prostate cancer is symptomatic, that usually means that it's already spread other places. That's why we like to screen for it and catch it before symptoms.
Dr. Manny says it's important to have conversations with your doctor about screening by the age of 45.
That's the key thing. I caught it early.
Because Henry found out about the cancer before it got worse, he was able to immediately get treated and is now cancer-free.
I would say that I'm doing well because even though I have a few after effects, things like I'm tired sometimes, because radiation sometimes does that. Overall, I'm doing good. I'm doing very good.
Now, Henry makes it his mission to spread awareness through cosmetology school.
And if someone isn't feeling well, even sometimes they have cancer, then we can have a little bit of a discussion.
So he can help folks get the care they need one step at a time. In Guilford County, Sydney Moore, WFMY News 2.
And it is great to hear that survivor story and the talk about early detection. So with us today is Dr. Luke Machen, a urologist in the Triad, and we're talking about the importance of being screened and the warning signs that every man needs to keep in mind. All right, so first let's just talk about those risk factors, a person's risk of prostate cancer.
Yeah, so there's a few groups of guys who are at a higher risk of getting prostate cancer. Probably the biggest one is if you have a family history of prostate cancer. This would be dad, brother, uncle, that kind of thing. Another big risk factor is if you just have a strong family history of all cancers. So if you've got a bunch of relatives with breast, ovarian cancer, that sort of thing. And then the last big risk factor is black race.
Okay, do we need to dig into any of those risk factors a little bit more about the family history or about the race, like any other kind of steps we should take?
Sure. No, I think with the family history, a few important things to point out are one, if you have a relative with prostate cancer, doubles your risk of getting the disease. And then if that relative either died of their cancer, if they got diagnosed when they were younger than 60, or if they had prostate cancer that spread to other parts of their body, that's an even bigger risk factor.
Okay, and anything extra with the race? Does it start any earlier or anything like that we should know about?
That's a great question. And earlier and more aggressive. And that's another one that almost doubles your risk of getting prostate cancer in your lifetime.
Okay, so with those factors in mind, at what age should men consider start getting screened for prostate cancer or just even talking to their healthcare provider about it?
Sure. I mean, any time is a good time to talk to their healthcare provider about it. But I will say, if you fall in that high risk category, it's a really good idea to get screened sometime between the ages of 40 and 45. If you're just a normal risk individual, probably sometime between 45 and 50.
Okay, gotcha. So in between that 40 and 50 kind of range, everybody needs to be getting tested. Okay, got it. So Cone Health, you have a free prostate cancer event coming up. So tell us what about that and how do we register and all that jazz?
Yeah, so it's coming up on September 16th, and there'll be a few different talks about everything prostate cancer. We'll talk about the disease itself, we'll talk about screening, we'll talk about treatment, and my area of expertise that I'll be talking about is kind of how to live your best life after treatment. You can register by calling 336-832-0849. We will also be offering free screening to guys between the ages of 45 and 70 who haven't been screened in the past year.
Okay, let's talk about this, some signs and some symptoms of prostate cancer that people should be on the lookout for.
Sure. And so honestly, in this day and age, with the screening that we have available to us now, most of the time, the vast majority of the time, the prostate cancers are detected before they would cause any problems in your body. It's just another thing that highlights the importance of getting screened.
Sure, but there's all those guys out there, because, you know, the women are always nagging the guys to go to the doctor that maybe have not been to the doctor, have not been screened. Is there anything that they should be looking for?
It's any problem with your body. I mean, possibly symptoms with your peeing, worse stream, you're going more often, you know, those sort of things. Blood in your urine is always a big warning sign of something that should be looked into.
Okay, that's good to know because, and again, the main point is listen to your body, right? Sometimes the guys don't always listen to it, but then we're hearing you grabble about it and stuff like that. So women, if you're listening to them listen, you need to help them get there. Okay, what's a common misconception about prostate cancer that you want to address?
Sure. It can happen to anyone. It is fortunately most of the time it is a slow moving, very treatable disease, but it can happen to anyone.
Okay, so don't think just because you don't have family history that you are out of the woods or that you're really healthy and you eat really well, that kind of stuff. That doesn't make any difference. Okay.
That's exactly right.
All right, so we talked about risk factors that we cannot change, age, race, family history, but what are some steps that people should take that might lower their risk of prostate cancer?
Sure. What I tell my guys, healthy stuff is healthy. Eat right, exercise, maintain a healthy weight. Don't smoke, and if you are smoking, stop as soon as you can.
Okay. Smoking seems to be like the root cause of lots of other things too. We've heard that with high blood pressure and some other things too. Okay.
Oh, yeah.
So let's talk about one more time about the free cancer event that is coming up at Cone Health, and kind of tell me like what that night of those couple hours holds. Like what will they learn? What will they do? What's the process?
Sure. So it's very low key. It's free. You'll have an opportunity to get any questions you may have answered. And like I said, there'll be talks on all things prostate cancer, with screening, treatment. And like I said, my area of expertise is sort of how to help you live your best life afterwards. But it is very, very informal. Please come with any questions you may have.
And how long does a screening take?
Literally seconds. So screening is a very simple blood test. It's called a PSA. And it's very easy. Just as long as it takes to get a little bit of blood, that's as long as it takes.
Okay, that is good to know. So it is a blood test, it is quick, and they can tell you. Final message that you'd like to share about prostate cancer and screening?
Guys, just get screened. It's so important. With this kind of thing, it's a lot easier to stay out in front of it than it is to play catch up, and it might save your life.
Absolutely. Thank you so much for your time and your expertise. And again, that free screening for Cone Health is September the 16th. We'll have all this information in the To Your Wellbeing section.